Welcome, Dr. Paloma Toledo. She is an assistant professor and director of obstetric intermediate care at Northwestern University, Department of Anesthesia. Thank you for joining me today. For those of us who may not know you very well, can you please give me a brief description about yourself?
Yeah, I'd love to. Thank you again for having me. I am originally from Miami. I'm Hispanic, and I grew up in South Florida and always knew I wanted to be a doctor. So I made my way progressively north. I went to undergrad at Duke University, and then I came to Chicago for medical school. I went away to Boston for a year for my internship, and then I came back to Northwestern where I did my anesthesia residency, my obstetric anesthesia fellowship, and I've stayed on faculty ever since.
That's wonderful, and it's so exciting. When you first completed your anesthesia training, did you know that you were going to pursue an academic career?
To a certain extent, I did, and partly it's because I had really good mentors. So when I was a medical student, I was introduced to Dr. Cynthia Wong, who became my research mentor and just lifelong academic mentor. And I did research for her as a medical student. And I was so impressed with her ability to ask questions and design studies that answered important issues that I knew from medical school that I wanted to be like her when I grew up. Yes, but it was a formative experience that really shaped my interest in academic medicine. Mm-hmm.
What led you to focus your research on obstetric anesthesia?
So I think I was always interested in women's health. Initially, growing up, I thought I was going to go back to Miami and work in an underserved community, and I always enjoyed women's health. During medical school, I contemplated doing an obstetrics and gynecology residency. So it was a big decision for me whether I should do OB-GYN or do anesthesiology. And then when I realized I could do obstetric anesthesiology, I think the decision was very easy for me that I could still stay involved in women's health, but do anesthesiology, which I loved.
You had pursued a secondary degree. Can you tell me a little bit about that and why you chose to do that and how that has helped you in your academic career?
Yeah, so I got my MPH after my obstetric anesthesia fellowship, and it was a little bit fortuitous in that I don't know that I necessarily would have sought out the opportunity to get a secondary degree on my own. But after my fellowship, I did a T32 research fellowship that was funded from the Agency for Healthcare Research and Quality. And the NIH at the time required that if you were involved in a T32 level, you had to get a master's degree. And so because of my interest in healthcare disparities, I chose to get an MPH. And actually, it's been one of the more valuable tools in my research repertoire because it has given me the skill set that I needed to do some of the disparities work that I have done over time. And I feel like it's also helped me as an editor in that I have a more nuanced understanding of statistics. So I don't know that everyone necessarily needs to get a secondary degree, but at the right time in your career, I think it can be extremely valuable to help you make the next leap to somewhere where you want to go.
And you also mentioned that you do some work in healthcare's disparity research. Mm-hmm. How did you get involved in that kind of research? And if someone else were to want to pursue something like that type of work, how would they go about doing that?
Yeah, so it's interesting. Again, it happened. I hadn't planned it that way. So when I was a clinical fellow in obstetric anesthesia, I realized that a lot of the patients that were in pain were Hispanic. And, a lot of times the nurses would come to me because Spanish is my first language and ask me if I would talk to the patients about labor epidurals. And oftentimes patients would change their minds and get an epidural. And so I was interested in why, when I looked at the literature, there was a racial ethnic difference in the use of labor epidurals. So I started talking to my clinical mentor about it, and she suggested that I branch out and look for other experts with healthcare disparities expertise. And so because of that interest, I went on to apply for the ARC T32 fellowship. And I met I knew one of my other research mentors, who's Bill Grobman, who's an obstetrician, who is an obstetrician, MFM, and health services researcher, and Romana Hasnain Winia, who was a disparities research. And with that clinical team, they helped me build the evidence base that really was the foundation for all of my work in healthcare disparities.
That's wonderful that you had opportunities to work with these mentors that open those doors for you. So that's great. You're also very involved in organized medicine with the ASA and FAER. How did you get involved in those roles?
So when I was a resident, one of the junior faculty at Northwestern at the time, Tripti Kataria, encouraged me to get involved in the ASA. And I think it was just based on a conversation we were having in the operating room about some anesthesia-related topic. She was like, you really should think about getting involved in the ASA. I had never really been involved in a national society on a leadership level before, but she's like, just run for president of the ASA resident component. And she just encouraged me to do it. And I did it and I won. And so then I became exposed to a lot of people in my network who have been friends and mentors over the years. And being involved in the ASA has allowed me to find interests and really pursue my passion. So I got to know Alan Sessler, who was the president and CEO of the Foundation for Anesthesia Education and Research at the time, and he brought me on to the FAER board. So really, it was early involvement and meeting people, and then really finding out what matters to you. So for me, helping build careers for physician scientists is one of my true passions. So that's where I ended up spending a lot of my service over the past few years with FAER.
I'm glad you mentioned this, because that's another reason for people to get involved with organized medicine, whether it's the ASA or another subspecialty organization, because it does open opportunities and also networking, which is so important for us to meet other people and see what other opportunities they can present for you, or you can present for them. So that's great. So you're a very busy woman, being anesthesiologist, a researcher, working in organized medicine, and also having your family. How have you been able to negotiate more academic time from your home institution?
So I think that's a challenge, especially these days in academic anesthesia, and it's becoming a problem when you look at the number of institutions that are doing research in academic anesthesiology. It's narrowing down over time, and I think partly it has to do with the funding streams. And that anesthesia doesn't have its own NIH institute, and we don't have a lot of NIH dollars. So a lot of research is departmentally funded. We're really lucky in that we have a department chair who is very supportive of the academic mission and really wants to help us succeed. So he has, given me some non-clinical time in addition to the non-clinical time that I get through my research grants. But I think being in a supportive environment is probably one of the most important things for research success these days, because, if your department doesn't have the bandwidth to support people being out of the OR, it really depends on people's passions and, ability to give their free time, like you said, because there are so many competing demands these days.
Mm-hmm, mm-hmm, mm-hmm. Yes, I think that's something that we all struggle with. What are your current thoughts on the system of academic promotion? Do you think that it's still relevant in today's world?
Every institution looks at promotion differently. So, the Harvard Hopkins systems for promotion is very different from other institutions, let's say. So a professor at one institution is not necessarily the same as a professor at another institution. And in addition to that, in some ways, the academic hierarchy has been taken away in some institutions where you're paid the same regardless of what your academic rank is. So it devalues the importance of striving to advance academically. There is no real incentive to become an associate or full professor. But I think it is important in that it does show that there is progression, and that you have this pipeline of research mentors and mentors in the field. So I wouldn't say that it's broken, but I know that there's a lot of work being put into how can you more holistically look at what the contributions are, because not everything is a peer-reviewed publication or grant. So I think a lot more work is being done to look at what educational contributions people are making and what people are contributing through social media and other venues, so that they do encompass the body of like what actual academic work is, as opposed to just like the one traditional view of number of papers, numbers of grants, and that's it.
Mm-hmm. Mm-hmm. And I think that is nice that they're doing that, because I think it does, as you said, instill a drive for people to feel like, oh, I can achieve as well, even though I don't have a traditional research repertoire. All right. Well, thank you so much. And thank you for your time.
No, thank you so much, Allison. This was wonderful.